why FHIR really matters in healthcare data exchange. Obviously, we've talked about it from an efficiency standpoint. I assume both in terms of the cost and time of managing those integrations, but also in the cost and time of people executing care, right? Like moving data around more efficiently has to have significant impacts across a payer organization. Is there anything that we haven't talked about in terms of places where this is really going to make an impact, or reasons that it's really transformational that we should talk about?
Well, I think we can probably kind of get one layer deeper, right? So if I was just talking about kind of the provider scenario, right? If you can imagine being a payer that has a network of providers that across 20 plus different EMRs, right? Historically, what would it look like to be able to bidirectionally communicate with those EMRs? Okay, sure, maybe some have HL7. A lot of the times, there are some companies these days, right, where they're kind of doing the heavy lifting of integrating with the EMRs, and then you're kind of just plugging in with them, right? But they still have to do the work. So ultimately, you're either plugging into one of those like kind of centralized API or integration layers, or you're doing custom feeds bidirectionally with each of those entities, right? So with FHIR, all of a sudden, especially with kind of the way we think about FHIR, some of these problems still exist with FHIR, and maybe, probably, I'm sure we're going to be talking about this in future conversations, because not everybody always interprets FHIR the same way, and that's kind of sometimes where the challenge is, and that's where we've been focusing a lot of our attention on. But really, imagine you being an entity that's able to integrate with those 20 different systems with kind of minimal friction, rapid speed to value, with high confidence that kind of the way, each of the different entities is communicating with you about the data that you have to discuss is more or less the same from a data model standpoint, right? So that just from again, anybody who's been in space for a while, that's just unheard of, right? So, just again, and, over time, you're going to be expanding that list or kind of shrinking down that list depending on what you want to do from a strategic standpoint, right? So just flexibility, speed, right? Those are going to be the common terms that we're going to be probably talking about every conversation.
Yeah, and I can add to that with a more technical eye, which I think some people are probably interested in. The API framework that FHIR uses is basically just RESTful, the RESTful architecture, and that is a industry standard, right? It's something that is not healthcare specific in any capacity, so multiple systems across the industry are already using that as a way to communicate, but it also means that when you're trying to integrate with external systems that may have information that you need, it becomes very easy. Right, I can go talk to another tech team and say, yeah, we've got a RESTful API that's exposed here for your push or your pull. And all they really need at that point is, okay, what do I query for this? Like, which fields are you using? Which criteria is important for you? And that's it. At that point, they query it, they get it back in a format that they understand, that they can parse, that they can interpret, that they can modify as they need to, in a way that is very, very easy to do because of how standardized and normalized it is across the healthcare industry. And, again, diving a little bit deeper into the technical aspect, FHIR defines each element specifically, as well as the data types and the extensions that you can use within them. And so what that means is that if I'm talking about ICD-9 codes, right, historically, when it came to HL7, V2, when it came to proprietary data formats, some systems would give you a code and a text in a single field. Some would just have a code available to you, right? Some would just have the text, whereas in FHIR, it's very clear about what you need to supply. And if you can't supply it, how to provide it in a way that, your system understands that. A really important aspect, I think, that Marcus touched on briefly when it came to why it's so important in modern healthcare data exchange is a convergence point. right? So if you're a healthcare organization or even a healthcare tech organization that's currently doing one type of work or one specific workflow within the realms of the healthcare industry, if you're now wanting to expand further out, if you're using a FHIR data model, you no longer need to create your own proprietary schemas. And this is really, really important for newcomers into the industry, right? 10, 15 years ago, you would have to come up with your own proprietary structure based off what you alone know that you need to do. And then 2 years down the line, you realize that you've added in like 6 different custom fields to the end of your table because there were scenarios that you weren't experienced enough to kind of foresee. Whereas with FHIR, the implementation guides that you have within specific domains, you've got Karen 4BB, you've got the Da Vinci, and ultimately the PAS claims, scenarios where you're saying, oh, I'm a newcomer into the space or I'm expanding my footprint in the healthcare tech space. I already know the data model that I need to use and the data points that I need to deal with. I no longer have to like go through the whole test of what I do and don't need and trying to incorporate backwards compatibility into your data schemas, etc. That's been historically quite difficult. Because FHIR is such a community-driven thing, and there are working groups across North America alone, let alone internationally, that deal with these situations. You can go join in on them, you can listen in, you can see the notes, and immediately, because you're all speaking the same language, you can very quickly identify like, oh, I hadn't thought of that, but that data point exists in this particular data structure, so I can use that if I need to, or I can simply store it for use at a later time. A more important aspect of that convergence is when you're expanding your footprint in the same industry or the same domain that you're in, right? It comes back to that point about proprietary data structures and the way that you deal with it. Previously, you would have your data structure. You would then talk to one system and they would transform it for you into that, right? And that's really, really individualistic when you look at it from an efficiency perspective. Whereas with FHIR, you can tell one client, hey, can you conform to this particular FHIR standard and I'll be able to deal with it in whichever way you want. Now, once you have that secondary part of the pipeline of going FHIR into your system done, every time you expand now, all you need to do is guide and ask the client to match to that FHIR specification. And that's it. Everything else past that point is already done for you when it comes to your data structure. Ultimately, for me, the aim of any really mature healthcare tech organization will eventually be to use FHIR as your underlying data model. It makes things easier, it makes things simple, it helps you integrate with new organizations a lot more quickly and a lot more efficiently, and most importantly, reliably. I think for me, that's probably the most important piece, is that you know what you're getting and you're not having to jump through hoops or create new weird workarounds every time you're dealing with a new system. I think that's why it really matters for us in the healthcare data exchange space, because it's not something that we've had before. For me, it's really awesome to see this. I saw, David Hay from my time at Orion Health was somewhat of a FHIR evangelist before anyone really knew what it was or what it was going to be used for. And now it's becoming, now it's a federal regulation. And I think that really speaks to its value, but it also speaks to how long it's being developed for. So it's a standard that has input from industry professionals, from subject matter experts and domain level experts, and gives you the confidence to really be able to move forward with that data structure without having the anxiety of like, am I going to have to change this later in a way that is specific to me or specific to my integration with one particular organization? It's smoother, it's easier. And I think it's very, very helpful for us.